Good evening, everyone present here. I am Faraz from IJCP Group. Welcome all the participants on today's webinar. That is on a very important topic, that is fat is the new gold, advantages in autologous fat grafting. And we need someone who is expert in this. So I would like to welcome today's speaker with great honor, none other than Dr. Vicky Jain sir. And let me share some of the achievement of sir. Sir has done MBBS, MS in general surgery, PCH in plastic and reconstructive surgery, consultant at the Clinic, Mumbai, and visiting consultant and plastic surgeon at Elizabeth Hospital, Masina Hospital, Apollo Spectra Hospital, and Wokhard Hospital, Mumbai. Without any further delay, I would like to invite sir and hand over this session to sir. Sir, the stage is yours. You can proceed from here.
So hello friends, I'm Dr. Vicky Jain, practice in Mumbai. So I have my own clinic practice and today I'll be talking about an interesting thing. Fat is the new gold and I'll be talking about the advances in autologous fat transfer. So this presentation will show you how fat, once considered in liposuction a mere byproduct, has emerged as a valuable bioresource offering unparalleled potential for healing and rejuvenation. So fat is being used in a lot of things. We will be talking about it. So, from byproduct to bioresource, understanding the paradigm shift. Historically, fat was often viewed as an undesirable excess. So, many fat people are like, "Meri charbi nikal do, I don't want that fat." However, recent scientific discoveries have unveiled its remarkable properties, particularly the abundance of adipose derived stem cells, which is very commonly used by a lot of orthopedics, by plastic surgeons for better healing. And this shift recognized fat not just as a filler but as a dynamic tissue, rich in regenerative potential, capable of repairing and enhancing various tissues. This new understanding has paved the way for innovative medical and cosmetic applications, more in aesthetics and in reconstructive also, which has caused redefining approach to tissue regeneration and body contouring also. So, what autologous fat transfer is? So, there is cellular richness. Adipose tissue is in abundance in a lot of people and is a rich source of mesenchymal stem cells, which is crucial for regeneration. Grafts integrate seamlessly with the recipient tissues, reducing the risk. So, it is our own product, so there's no foreign body reaction. And growth factors also contains numerous growth factors that stimulate healing and angiogenesis. So autologous fat transfer involves harvesting fat from one body part and re-injecting into another. The most common body part is either tummy, thighs, and sometimes back. And the success hinges on the viability of the harvested fat cells and the ability to integrate and survive in the new location. So it can be knee, it can be your face, it can be your breast, anywhere. The process leverages the body's natural healing mechanism of long-lasting agents. So journey through time, early challenges in fat transferring grafting was early attempts at fat grafting were often met with unpredictable results, leading to a period of skepticism. Challenges include poor graft survival, unpredictable resorption rates, and complications like oil cysts or calcification. Limited understanding of fat cell biology and crude harvesting technique contributed to these setbacks. So, with the growth in the scientific backgrounds, what we are doing for fat grafting, things have changed. There is laser, there is laser, there is power assisted liposuction, and with growing times, we have learned from our mistakes. So, these initial difficulties, however, laid the groundwork for future research and refinement, pushing the boundaries of what was considered possible in tissue transplantation. So the key to successful fat transfer lies in gentle atraumatic harvesting. So if you're doing with a machine, we normally keep the half pressure, and if you're doing with a syringe, we use a 20 cc syringe or maybe 50 cc syringe, and we go slow. So modern techniques employ specialized cannulas with smaller diameter and lower suction pressures to minimize damage to the delicate fat cells, and water jet assisted liposuction and power assisted liposuction are example of advanced method designed to yield high quality viable adipose tissue. These innovations ensure that the harvested fat retains its cellular integrity and regenerative potential, leading to a superior clinical outcome. The art of purification. After harvesting, fat cells must be purified to remove impurities like blood, oil, fibrosis tissue, and damaged cells. Centrifugation is a widely used method to various variation in speed, duration, significantly impacting graph viability. Other techniques used are decantation, filtration, and washing, uh, each aiming to concentrate the most viable adipose tissues and stem cells. Optimized purification protocols are used and critical for maximizing the survival rate of the transferred fat and ensuring predictable results. So, what is when we inject? What needs to be done? We do a micro droplet injection, small multiple injection to ensure even distribution of fat and vascularization. So, if you put a big chunk of fat, that can cause central necrosis, and the fat cells don't survive because of uh, poor vascularization. Multiplanar layering, injecting in different tissues at different depths for natural contour and support, and targeted volume strategic placement to achieve precise aesthetic and reconstructive goals. The success of the fat transfer heavily relies on the precise and the meticulous placement of the graft. Injecting the fat in small aliquots, such as known as micro droplet injections, maximum contact with the recipient's tissue and enhancing revascularization. This technique promotes better graft survival and a smoother, more natural contour. So beyond aesthetic, diverse applications are also available. So aesthetics is a very common thing, but now it is being used in a lot of reconstructive procedures for breast reconstruction after mastectomy, for correcting soft tissue defects, for diabetic foot also. Its regenerative property also shows promising in treating chronic wounds, osteoarthritis, and even certain neurological conditions. The versatility of the fat as a therapeutic agent continues to expand, opening new avenues in the regenerative medicines. So, clinical usage, first we'll be talking about the cosmetic procedures. Facial rejuvenation used to restore lost volume, reduce wrinkles, and improve facial contours. Breast reconstruction and augmentation can be used to reconstruct the breast after mastectomy or to augment breast size. Lipofilling is very common. Gluteal augmentation, that is called very common condition all over world, is used a Brazilian buttock lift, BBL, used to enhance the shape and size of the buttocks. Hand rejuvenation, because in old people you lose fat in your hand, so restore volume to the hand, reducing the appearance of the vein and the tendons. Scar revision can improve the appearance of scar by adding volume and promoting tissue regeneration. Treatment of soft tissue defects addresses congenital or acquired deformities, including those resulting from trauma or tumor. Addressing volume loss can be done in various body parts, uh, because by aging, weight loss, and other conditions. Vitiligo, gray hair, and alopecia. Alopecia also can be has shown promising results. Clinical use of fat transfer, cleft lip repair, autologous fat transfer can improve post-surgery lip symmetry, contour, appearance of cleft lip repairs, both during primary and secondary surgeries. Scar treatment, as I told you, breast reconstruction, defect reconstruction, because of trauma, tumor, and congenital anomalies. TM joint also we can be putting fat for better healing. Neurosurgery, it can use for CSF leaks in skull-based surgeries, and it can be used in ENT too. Just 1 minute. Yeah. Orthopedics also. So osteoarthritis, it's a very common thing nowadays. A lot of orthopedic surgeons call us for liposuction and for knee post ACL repair. We can use in knee also. Hand surgeries to treat dupuytrenal contracture, which is which it restores the volume. Painful amputation stump, we can put on the amputation stump for avoiding direct contact of the nerve and reduces nerve irritation. And soft tissue defect, it can be used to correct soft tissue defects resulting from trauma, surgery, or congenital anomalies. So future lies in using adipose tissue. The future of adipose tissue holds immense promise. Research is focused on optimizing fat viability to cell enrichment techniques, exploring ex vivo expansion of adipose derived stem cells, and developing biological scaffold for enhancing graft integration. Fat is no longer a filler, It is a regenerative gold mine with proper techniques and knowledge. Autologous fat transfer offers a safe, effective, and versatile tool in modern medicine. It truly solidifies its status as a new gold. Thank you.
Thank you so much, sir, for taking out your important time and sharing your knowledge on this topic. I definitely think this session knowledge is going to help all the participants on their practice too. Sir, we have received some questions, sir. With all your permission, shall we take these questions one by one?
Yeah, yeah, sure.
First question from Dr. Ayushman. He is asking how do methods like nanofat and microfat differ and what should be used? Could you please share some point on that?
So for restoring volume, most common thing is we use normal fat, but nano fat and micro fat are used for rejuvenation and regeneration of uh, certain this thing. Like just like in osteoarthritis, we use nano fat for stem cells. If you use the bigger the fat which is harvested immediately, that won't be of use. So nano fat has different applications. Micro fat also has different applications, but the fat which we harvest is normally used for restoration of volume, not for regenerative purpose. Yeah.
Thank you so much, sir, for sharing your insight on that question. We will take another question, sir. What are the contraindications or patient selection criteria to be aware of before offering autologous fat grafting, sir?
So we have to be very clear with the patient that the amount of fat which you are putting, approximately 50 to 60% might get resolved. So we try to overfill, and a couple of sitting might be requiring for what are the volume defects. For nano fat and for regeneration, we tell it's still a topic of discussion, but it has shown results in 70 to 80% of the people. That's why we're going ahead of it. It should not happen that the patient is telling, okay, I have got it done and I have not seen any uh, difference after the surgery. But most of the patients feel better and they're benefited after the surgery.
Thank you so much, sir, for sharing your insight on that question. And one last question, sir. Can you please
Yeah.
share a challenging or unusual fat grafting case and how do you manage it, sir? Like some point and some insight from that
So
experience.
So I had a patient female who I had grafted. She had a typical query that her face looks very thin, and we had put approximately 100 cc of fat. Out of that, 50% resolved, and she had was coming back. She was like, "My marriage will break because of this. My in-laws are not liking my thinned out face." So I told her, "See, if the marriage has to break, it will break any which ways. It is not because of this." So the expectation of the people are very different with the cosmetic surgery. So the proper counseling is simple. This surgery is not difficult, but when we're doing it, a proper counseling of the patient is difficult, is very important. So surgery, as you ask me, nano fat transfer or fat transfer is not a difficult option. I'm telling you, it's a very simple surgery. It's a daycare surgery. The patient comes and goes away, but after that the results are very much unpredictable most of the times, because you have to tell patient might require a second sitting also of a surgery. We have to be very clear and counsel the patient in that matter. So I don't see any problem with that.
Thank you so much, sir, for sharing your expertise on that case discussion question, sir. I hope, sir, I can't see any further questions, sir. I hope you have done justice to this topic, sir. As there
uh,
is no more questions, with all your permission, shall we conclude this session for
yeah,
today,
yeah,
sir?
sure, sure. And really sorry I
Yes,
was
sir.
late. I got stuck up in some surgery and that's
No,
why
sir,
I
it's
came
totally
late.
understand, sir. Like it's very difficult to get time from the busy schedule, sir. And we would like
Okay,
to see you in future also with different topics, sir. Till then, take care of
sure, sure.
yourself. It was great honor to have
Okay,
you, sir.
okay. Thank you, thank you.
Thank
Have a
you.
good day. Bye.